Welcome back to the Senior Health Podcast. I'm Dr. John Miller, and today I want to begin with a simple but unsettling truth. You can do everything right. You can eat well, avoid smoking, stay active, and still, without a single warning, cancer could be quietly growing inside your body. For many older adults, this is not a rare story, but a common one. Studies from the National Cancer Institute show that nearly 40% of cancers in seniors are only discovered once they've already advanced to later stages. And yet, when caught early, survival rates can rise from under 10% to over 80%. That's a dramatic difference. But here's the challenge. Many early warning signs are mistaken as just aging. Fatigue, indigestion, or changes in appetite are brushed aside until valuable time is lost. Sitting across from me today is someone who has spent a lifetime helping people listen to these subtle signals of the body. At 84 years old, he continues to inspire with his wisdom from both medicine and tradition. It is an honor to welcome back to the podcast Dr. G. Hinohara.
Thank you, Dr. John. It is always a joy to join you and to speak to our listeners. You are right, this is one of the great tragedies of aging. The body whispers, but too often we dismiss its voice as unimportant. There is a Japanese saying, "The silent river runs deep," meaning what appears quiet on the surface may hold powerful currents underneath. So it is with cancer. What looks like a small discomfort may carry the weight of a larger illness.
That's beautifully said, Dr. Hinohara. And it captures the heart of our topic. Today we're going to explore 9 subtle signs often brushed off as nothing that could in fact be early warnings of cancer. But more than just listing symptoms, I want us to explore how we can tell the difference between ordinary aging and something more serious.
Yes, because the danger is not that these symptoms are rare, but that they are common: a fading appetite, a cough that lingers, or a mole that changes shape. These can all be explained away as simple aging or minor complaints. But I have seen with my own eyes how these little signs were, in fact, the first clues to something much deeper.
Exactly. And I think that's where many of us, especially as we age, struggle. How do we know when to ignore a symptom and when to pay attention? Perhaps we can start with one of the earliest and most overlooked signs: the loss of appetite. Let's begin with appetite. Many of us lose it now and then, maybe after a flu, during stress, or even when we've just had too many heavy meals. But cancer-related appetite loss is different, isn't it, Dr. Hinohara?
Yes, very different. When cancer begins to grow, it releases chemical signals that disturb the brain's hunger center, the hypothalamus. It is as if the body quietly says, "Do not eat," even when nourishment is needed. In Japan, studies show that older adults who reported persistent loss of appetite without reason like illness, grief, or medication were far more likely to develop cancers of the stomach, lungs, or intestines.
That's fascinating, because from a Western medical perspective, we often tell patients not to worry unless there's significant weight loss. But what you're saying is that the absence of hunger itself, when it lingers, is a red flag.
Exactly. Temporary loss of appetite after flu or stress is normal. It passes. But when weeks go by and food no longer calls to you, that is a whisper from the body not to be ignored. And the weight that disappears is not only fat, it is also muscle and strength. We call this cachexia. It leaves the body weaker each day.
And that weakness becomes a double burden, fighting the disease and losing strength at the same time. For our listeners, if appetite loss lasts more than 2 weeks without a clear reason, it's time to see your doctor. That's a clear, actionable point.
Yes, I tell my patients, do not wait for your body to shout. Listen while it still whispers.
Beautifully put. Now, another subtle sign you mentioned earlier is fevers and night sweats. Many seniors dismiss them as stress, menopause, or even just running warm. But medically, what's happening?
In cancers like lymphoma, the immune system is disturbed. The body's thermostat, deep in the brain, becomes confused, so fevers rise and fall without infection. And at night, sweat soaks the sheets. Unlike flu, there is no sore throat or cough to explain it. Only the heat, again and again.
That's such an important distinction. In Western medicine, we see the same. Fevers that linger without clear cause deserve investigation, and over-the-counter remedies, pain relievers, antibiotics, rarely make a lasting difference.
Yes, the true warning is persistence. When the fever or sweat returns, no matter what you do, in traditional Japanese medicine, We see this as the body's inner fire being disturbed. Too much flame, not enough balance.
So if appetite loss is the whisper of silence, fevers and sweats are the whisper of heat.
Exactly. The body speaks in many languages. We must learn to listen to all of them.
That brings us to another language the body speaks, our skin. I've often heard dermatologists say that skin is a window into our health. What do you tell your patients about changes in moles or spots?
The skin is like a scroll upon which life writes its story. But when a mole changes, grows larger, changes colour, becomes uneven, that is not just age writing. It can be melanoma, a dangerous skin cancer.
And in Western medicine, we use the ABCDE rule: asymmetry, border irregularity, color change, diameter over 6 millimeters, and evolving appearance. But even with these tools, people delay.
Yes, because a mole is painless, people think it harmless. But I tell them, pain is not the only messenger. In Japan, we also remind patients that melanoma may appear where the sun never shines, the soles of the feet, under the nails, even inside the mouth.
That's a sobering reminder. It's not only about sunscreen or sunburns, it's about vigilance.
Yes, a quick self-check once a month can save a life. The body often shows us the truth, if only we look.
Another sign that gets overlooked so often is the cough that just won't go away. Many people assume it's just allergies or maybe a stubborn cold. But in some cases, it's much more serious, isn't it?
Yes, John. A cough that lingers for more than 3 weeks should never be taken lightly. In lung cancer, abnormal cells irritate the airways. The result is a dry, persistent cough that refuses to heal, no matter how many syrups or lozenges one tries.
I've seen this too. Patients come back again and again trying antibiotics, inhalers, even herbal teas. But if the cough is cancer-related, those remedies may offer only false reassurance.
That is the danger. Infections usually pass within a week or two. A cancerous cough grows stronger. Sometimes it is joined by shortness of breath or a heaviness in the chest. And yet, because there is often no pain in the early stage, people dismiss it. By the time pain arrives, the disease has already moved further.
So the lesson is, listen before pain forces you to listen.
Exactly.
Now, speaking of things we may feel but try to ignore, let's talk about lumps or swellings. These can appear in the breast, the testicles, or even lymph nodes, and often people wait, sometimes out of fear, sometimes out of embarrassment.
Yes, and waiting is the most dangerous choice. A firm lump in the breast that does not move, or a swelling in the testicles, even if painless, should always be examined quickly. In my years of practice, I have seen too many men and women who ignored these signs, believing no pain means no problem. But true cancer grows steadily, without pause, whether or not it hurts.
That's such a critical point. Many women mistake malignant lumps for the normal tenderness that comes with hormonal changes. But cancer doesn't come and go. It stays and grows.
Yes, and men too often delay because of shame or denial. But I remind them, the body is not your enemy. The lump is simply a message asking you to pay attention.
That's powerful. And sometimes the body sends an even clearer message. Blood appearing where it should never be, in urine or stool, for example.
Yes, blood is one of the most unmistakable signals, and yet it is also one of the most ignored. People assume it must be hemorrhoids or perhaps a urinary infection, but often it is the earliest sign of colorectal, bladder, or kidney cancer.
And there are important distinctions, aren't there? For example, in colorectal cancer, blood tends to be darker and mixed with stool, while hemorrhoids usually cause bright red streaks.
Exactly, and in bladder cancer, blood in the urine often causes no pain at all. That is why it is so often dismissed. But the absence of pain does not mean the absence of danger.
And even subtle bleeding, just a trace again and again, can slowly lead to anemia, fatigue, and weakness. Another whisper that gets brushed aside until it's too late.
Yes, the message is clear. Whenever the body shows blood where it should not be, it is time to seek answers, not excuses.
Another signal the body sometimes gives, one that many of us dismiss, is trouble swallowing. At first, it might just feel like food is moving a little slower, or that liquids catch in the throat. But when it persists, it can mean something much more serious.
Yes, John. We call this difficulty dysphagia. When tumours form in the esophagus, they gradually narrow the passage. At first, people may notice it only with bread or meat. Later, even soft foods or liquids feel as if they are sticking. And because it worsens slowly, many adapt without realizing it. They chew more carefully, choose softer foods, and think it is just aging.
That's so true. I've had patients who lived on soups and smoothies for months before finally coming in. They thought it was simply reflux or heartburn.
Exactly. Acid reflux improves with medicine or diet changes, but cancer-related swallowing trouble does not. It quietly worsens week after week. By the time weight loss and fatigue arrive, the disease may already be advanced.
So the difference is persistence. If swallowing feels harder each week, it's a red flag, not just indigestion.
Yes. And in traditional Japanese medicine, we say, when the throat closes, the heart cries out, meaning when nourishment is blocked, the whole body suffers.
That leads us naturally to another sign, persistent indigestion and bloating. Almost every senior has felt these at some point, but what makes them different when cancer is involved?
Indigestion is indeed common, often from spicy foods or stress, but cancers in the stomach and sometimes in the ovaries can cause early fullness, indigestion, or bloating that doesn't go away with usual remedies. If these symptoms persist, they should be checked by a doctor. The stomach swells, but the body is not nourished.
That's striking. From the Western perspective, too, we know that ongoing bloating and fullness, especially when antacids or dietary changes don't help, may be an early sign of stomach cancer.
Yes, I've seen many older patients who carried antacids everywhere, never suspecting the real problem. The tragedy is that when weight loss and weakness finally appeared, the cancer had already advanced. Yet, when caught early, stomach cancer can often be treated successfully with surgery or targeted medicine.
So again, the key is time. When bloating lasts weeks instead of days, when fullness comes too quickly, that's when to act.
Yes, the body's not being stubborn, it is sounding an alarm.
And that brings us to the 9th sign, a voice that won't return to normal. Many of us get hoarse after talking too much or from allergies, but what makes hoarseness a warning sign?
When tumours form on the vocal cords or nearby structures, they swell the tissues. The vibration that creates sound is disturbed. At first, it may sound like a lingering cold, but if hoarseness lasts longer than 3 to 4 weeks, despite rest or treatment, it should be evaluated by a doctor as it can sometimes signal cancer of the voice box, throat or lungs.
In Western medicine, too, we emphasize that persistent voice changes could point to laryngeal or throat cancer. And what's important is that these cancers are highly treatable if found early.
Yes, I recall patients who tried every home remedy, tea, honey, lozenges, believing time would heal the voice. But when the voice does not return, it is the body itself asking to be heard.
That's powerful. The voice, in a way, becomes the body's messenger, carrying its plea for attention.
Indeed. And when we ignore the voice, we silence more than sound. We silence an early cry for help.
So now we've walked through all 9 of these subtle signs: loss of appetite, unexplained fevers, skin changes, a lingering cough, lumps, blood in stool or urine, swallowing troubles, indigestion, and hoarseness. Looking at them together, I notice a theme. None of these symptoms arrive suddenly. They don't shout, they whisper.
Yes, John, that is the tragedy and also the hope. The body is a patient teacher. It repeats the lesson again and again, waiting for us to listen. But too often, we excuse the signs as just aging. In doing so, we give disease the time it needs to grow stronger.
That really resonates. In Western studies, we see the same pattern. When cancers are caught early, survival rates rise dramatically. But waiting out of fear or denial, costs precious time.
In Japan, we have a saying, "He who hesitates loses the harvest." The same is true in health. When we delay, the season of healing passes us by.
That's a perfect way to put it. So for our listeners, let's make this practical. If you're watching this at home, here's what you can do. Pay attention to persistence. If a symptom lingers beyond 2 weeks without a clear reason, it's time to see your doctor. Don't excuse blood, lumps, or weight loss. These are never normal aging. Check your skin and voice. Small changes matter when they don't fade. Make screening part of your yearly rhythm. It's not a burden. It's protection for yourself and your loved ones.
Yes, and remember, early detection is not about fear, but about hope. Each small act, checking your skin, noticing your appetite, speaking with your doctor, is a way of respecting your own life.
That's such an important reframe. Screening is not just a medical test, it's an act of self-care.
And of love for yourself and for your family. I will share one last thought. When I was young, my teacher told me, "The body does not betray you, it warns you." If we live with that wisdom, we can catch illness before it becomes our enemy.
That's powerful. Dr. Hinohara, thank you for once again sharing your wisdom and blending traditional Japanese insight with modern science.
And thank you, John, for bridging East and West. Together we can give seniors not only longer lives, but lives filled with clarity and peace.
And to our listeners, if you've noticed a change in your body that doesn't make sense, don't wait for it to get worse. Take action now, and let us know in the comments where you're listening from and whether this episode has helped you reflect on your own health.
Yes, and try even this week to listen closely to your body. Perhaps it is already whispering.
That's a beautiful note to end on. Until next time, thank you for joining us here on the Senior Health Podcast.